Good afternoon, everyone. Uh, Welcome to our leadership workshop titled Improving Patient Handoff Management to Enhance Type 2 Diabetes Care at the Northbridge Community Health Alliance. My name is Omer Salim, and I'm joined with my colleague Michael Usu. Together, we will be discussing how effective leadership and structured communication can improve the management of type 2 diabetes patients and reduce errors caused by poor hands off between departments. So, this training supports a mission of ensuring safe, consistent, and patient centered care across all departments. Um, our full recorded session will be available on our YouTube channel and YouTube channel for all members and staff to review on their, at their convenience. If you are watching this as a recording, please use the link on this slide to rewatch or share this session with your team. This workshop is part of our broader leadership development initiative aimed at improving effective communication practices that directly affect patient safety. So, we're coming on to the learning objectives. By the end of the session, you will be able to understand how mismanagement of handoffs impacts patient outcomes, particularly among those with type 2 diabetes. Identifying best practices for structured hands-off using standardized communication tools like SBAR. So these are the two objectives. Now, coming on to the third objective, we also need to recognize the vital leadership and management roles required to create a culture of accountability and safe communication. And lastly, implementing practical strategies to strengthen the departmental collaboration and patient's continuity of care. So, these are the objectives which will guide you to the training we are about to go through. So let's begin with some context. Type 2 diabetes affects approximately 37 million Americans, accounting for nearly 95% of all diabetes cases. And at North Bridge Community Health Alliance, data analysis showed that around 25% of our diabetic readmissions were linked to unclear or incomplete patient transfers or patient handoffs. So example includes missed medication details, incomplete documentation during transfers, and delayed follow-ups after discharge. So as leaders, we must recognize that these breakdowns are preventable and that better and effective communication can save both lives, resources, and specifically time, because the time management is really important when it comes to these things. So from this slide onwards, my partner and my team member Michael would continue with the rest of the presentation.
Hilma, thank you. Okay, so I will be continuing from the list application. And from this slide, well, leadership is not just about managing people. That's one thing that we need to know. It's about influencing systems that make safety routine. Uh, Leaders must set the tone for open structured communication. And the S bar, or maybe like the SBAR model, which stands for Situation Background Assessment Recommendation, it provides a clear uh, and standardized way for healthcare teams to share patient information. Well, to go further into this, I would like to give an example as we are discussing this S-bar model. So let's have a situation where there is somebody called Mr. Mike, let's say Michael, who is 58-year-old. Uh, he's 58-year-old diabetic patient who was recently just discharged from the ER. Uh, the background here will be he was treated for hyperglycemia and given new insulin instructions. Now, with the assessment, we would have something like he appears stable but confused about dosage. And what is going to be the recommendation? The recommendation will be a follow-up call within 24 hours to confirm adherence. Now we move on to the small group activity involved. As part of this presentation. Uh, well, now let's apply what we've learned in a small group scenario. Imagine this. So we have a type 2 diabetic patient. Is transferred from the emergency department to primary care. The insulin dosage instructions are not passed along during the transfer. Now, in groups, we break into groups to identify where the communication failed. Then we're going to rewrite the handoff message using the S-bar format we just reviewed. And maybe after, let's say, 5 to 10 minutes, we all come back together and discuss the examples. Here, we are going to think critically about what leadership actions could have prevented this issue. For example, of actions that can actually prevent it can be clearer policies, cross-departmental communication logs, or a standardized EHR templates. So for our question and answers and discussion, there are a few questions that we derived from this topic, and one of the questions that we would like to ask is what barriers exist during shift handoffs, and how can leadership encourage consistent documentation? This is our additional resources, and thank you for your time and engagement.